Hello, I'm Jenna Kantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists. Today, I am interviewing Dr. Danelle Dixon, who is joining us from Washington, D.C. So hello, welcome.
Hi, everyone. Hi, Jenna. So thank you so much for having me on. I'm so excited to talk with you guys today.
Oh, yeah. This is going to be a great one. So Dr. Danelle Dixon is a graduate of the University of Delaware, has over 11 years of clinical research and administrative experience in physical therapy, sports, and orthopedic fields. She founded Performance Plus Physical Therapy with the goal of providing a different rehabilitation experience for patients. Danelle specializes on injury assessment and prevention for performing artists. She has been trained in manual-based courses such as Institute of Physical Arts and St. Augustine courses, and received her board-certified orthopedic clinical specialist certification in 2012. Whoa, that's amazing. So Danelle, this is great. Danelle has performed research in the dance medicine field. She has also presented research at the local APTA and international IADMS. So APTA stands for American Physical Therapy Association, and IADMS stands for an International Association of Dance Medicine and Science. So she has presented at both of these conferences on dancers and has additionally published her research with the Journal of Dance Medicine and Science. Oh, I look up to you. Personal goals of mine. So at present, Danelle works with a variety of diagnoses, including common orthopedic and sports injuries, including post-operative conditions. She specializes in working with dancers and works with the local DMV dance population and taking care of their injuries. You are the ideal person to be interviewing today.
Awesome. I'm so happy to be here.
Great. So she is joining us today to discuss specifically the best ways to identify when you are injured and what to do during a show or class. So Danelle, why is injury recognition and prevention important?
So injury recognition and prevention is so important for several reasons. The one that really kind of comes to mind that I'm most passionate about, besides the obvious, in order to have longevity in your dance career as a dancer or as a performing artist, it's important that you maintain your body. Your body is the tool that you are using in order to perform everything. So if you're injured, for obvious reasons, you cannot perform or you cannot dance. But injury recognition and prevention is specifically important because dance, even though it is an art form and we do have this aesthetic about it, it is a sport. It is an athletic activity. And as such, we have to treat it as such. And we get very bound down by the aesthetics and the art form that we really miss the athletic parts and how much demand we're actually putting on our bodies in order to perform this. So just like with any orthopedic team, any sports team that has specific regimens where they go through and they look at how they're performing and they have injury prevention and they have a medical team. The same needs to be applied to dancers, and that commonly has not happened in the medical world in terms of treating it as a sport that it is. If we are not able to maintain our bodies and to make sure that we are identifying injuries and injury patterns before they actually happen, we're not going to have the longevity that we have. So that's exactly why recognition and prevention, of course, is really important for dancers.
Amen. I could not agree with you more. So currently, are dancers good at recognizing if they are injured and why?
I would say 70% yes and 30% no. And here's the reason behind that. 70% is dancers. The reason why I personally love working with dancers is that we are very in tune with our bodies. If we have a shift just a little bit to the left or to the right, we can tell because of the requirements of our sport or our art form. So most times, more often than not, we are very much more in tune with our bodies than most of the regular population. But on the other side of that, dancers have really difficulty identifying what an injury is because we have difficulty differentiating between good and bad pain. And that comes from a variety of things. We have the concept of no pain, no gain mantra. So, you keep pushing, even if whatever pain that you have is regarded as good pain and it's seen that it's something that's positive. And we really ignore the very obvious signs that our bodies consistently tell us that this is something that's wrong. And also, in addition to that, we also have in the industry, in the dance world, we have the show must go on. So there's this fear, and there's this concept of, if I do feel pain, then I shouldn't say anything about it, because then the show will go on without me. Dancers love their sport, just like any other athlete. We love our sport. We will do anything that it takes in order to get moving and to stay on that stage. So a lot of dancers they will have pain, but they will completely ignore it, or they will dismiss it as, this is something that's usual, it's supposed to happen. And a lot of those factors, as I mentioned before, kind of create the perfect storm, where a lot of times when dancers do get injured, they're usually dragging themselves into the clinic, because when a dancer can't move, they're not moved. That's when they stop, versus when they first feel pain, or when they first notice that something is off, they'll just keep plowing through it. So to answer your question in general, dancers are good, but our culture really supports a system where we're not able to stop and recognize and implement strategies in order to prevent a small problem from becoming into a big one, or even to a point where a dancer is seriously injured and is unable to go through with their performance, or on a bigger scale with their career. So.
Yeah. And this is the beginning of a conversation about this. This is great.
Mm-hmm.
What would you say is the role of the dance community or team, for example, the parents, teachers, and choreographers, in helping with this recognizing and preventing injuries?
I think it's really huge. And this is something that I would say within the past 5 years has become really near and dear to my heart. A lot of people put a lot of emphasis on dancers and what they should do in order to, perform well, to eat right, to stay flexible, to stay uninjured, to get ready for shows. But there's a huge gap in the educational component that dancers have in terms of recognizing injuries on their own, understanding what good and bad pain is, and figuring out what the resources are that they need in order to address the symptoms if they do have it. And a lot of times that comes from the support system that they have. Dancers don't operate in a vacuum. We have a community, and the community are fellow dancers. They're the parents, they're the teachers, they're the choreographers. So with each of these groups, parents, teachers, choreographers, if there's not an educational or understanding of why a dancer should stop dancing when they have this pain versus that pain, or the concept of not hiding injuries and educating young dancers into saying, if I have a problem, I should say something to my teacher versus, keep on working through it. Or choreographers who are willing to create safe spaces for dancers to come and say, hey, I have this problem. Can you maybe adjust the choreography so every time I do that grand battement to the left, it's not killing me and I don't feel it in my back? Simple things like that is really, those small minor changes can really make a big impact on the burden that dancers have to keep themselves not injured. Because as it stands right now, it is a burden. Dancers have a very long hill to climb in terms of figuring out, how do I navigate this outside of just the stresses of being a dancer, rehearsals, performances, auditions, getting the right shoes, getting the right clothes. If I have something medical, how do I pay for it? There's just not a great support system for dancers to figure out, if I have injuries, how do I figure this out? Who do I go to for help? Is this a serious injury or is this not a serious injury? Will my teacher understand? Will I be able to perform? There are all of these stresses. And that really contributes to dancers consistently making bad decisions about their body that affects them later in their career. So it's really important that this community, teachers, parents, choreographers, really get on board in providing the support that dancers need in order to excel.
Yeah, I think that's, I am completely on the same page with you. What would you say are the risks if an injury is missed?
The risks to a dancer, it depends on the seriousness of the injury. If it's a mild injury, it's kind of opening the door for more chronic things to come along for the dancer. If it is a serious injury, for obvious reasons, just like with any other athletes, you're going to have a situation where that dancer is unable to perform. And we're talking anything from, a minor sprain or ankle roll that, if not rehabilitated correctly, can start developing into chronic ankle sprains, to, if you kind of really did something crazy and tore your hamstring and you're just not able to even get into a plie anymore because you have so much pain. So when teachers and the community and dancers themselves also are not able to really pinpoint and recognize this is bad pain, this is something that I need to take care of right now, you really risk affecting the longevity of your career, your ability to dance in the future. Everything downhill is affected from there. You
Oh
know?
yeah, and even just your life after when you retire.
100%, 100%. You know,
You physically live after you retire.
yes,
And that's a big thing to consider.
100% agreed. And a lot of dancers, it's funny. A lot of dancers, they live in the now, and they think like now is the only and the most important moment of their life. I have to make this audition. I have to get that leg to 90 degrees. I gotta whip those 3 turns and then go into a split or whatever crazy thing that they're doing. But they never think of what happens after. Like, what if you got to go to work and you had a job and you have to sit and you can't sit? What happens then?
Yeah.
You know, what if you can't walk upstairs anymore because you whacked your knee out? You were great in your audition, but now you can't walk up a flight of stairs to get to your apartment. What happens then? You know, so, you know, ignoring injuries is just never a smart thing. And that not only applies to dancers, it applies to just everyone. The faster the intervention, the faster the ability for it to be resolved. Things that you sit on for a long period of time that become chronic just becomes more difficult to treat, and the outcome is not, there's a good chance that it may not be the best outcome that you're looking for. So
right. Let's go into more depth. So how would you categorize the level of seriousness of an injury for a dancer?
So the level of seriousness of an injury for a dancer, for me, what I have done, I have put together in the past year and a half a dance injury series where I do workshops for dancers, and I really try to educate them on a lot of the pieces that I'm discussing in this podcast with you. And what I do is I've put together a couple of yellow flags and a couple of red flags for dancers to really identify this. If I have this, this is what I do. Or if I have this, this is what I do. Because it's easy for us as clinicians to recognize it. And even for some maybe educated teachers or choreographers to say, you need to go to the ER right now. But dancers that don't have that background, it's really difficult for them to understand how serious is this. So with the yellow flags, what I really emphasize for my dancers is looking at simple things. Do I have pain that I have not experienced before? Do I have swelling? Do I have a change in the range of motion of a joint? Every time that I do a turn to the left, I have pain, but when I do to the right, I don't? That's your yellow flags. That's when you want to say something is up. I need to slow down. I need to take a look at this. And I encourage them to speak with their teacher, their local professional, physical therapist, or health professional that they care about, and start really addressing and take a look at that now. It doesn't mean stop, but it does mean slow down and stop and assess what's going on. In terms of the red flag, exactly, in terms of modifying also. In terms of the red flags, we're talking about something has happened, and we're usually looking at something that's happened that's traumatic. You slip and you fall on stage. There's a fracture, you know, your ankle has blown up. You can't weight bear on your ankle or on your lower extremity. You've had pain like you've never experienced before. In that case, you need not only triage, but you need medical attention right away. That's when you go seek a physician right away. You go to the ER. You do not wait. You don't stop. Don't pass go. Don't like 200. Just go straight to the ER. You know, it's not the time to say, well, maybe I can work it through. No. So I really educate my dancers on, do you have this? This is what you do. Do you have this? This is exactly what you do. So they have those tools that they can recognize it right away. To follow up with that a little bit, another thing that I do teach in my workshops is I have a little bit of a tool that where dancers can go through a little bit of a multiple choice question that kind of gives them, you know, how long have you had pain? Can you do this? Can you do this? And it kind of directs them into things where, you know, it's probably a mild injury, seek a little bit of advice, do some stretches, work it out, come back to it, revisit it. Maybe you need to talk to a physical therapist, go see a physical therapist or a health professional now. So it gets a little bit more detailed into if they're having one specific problem that they're not sure that they need help with. So that's how I kind of let dancers figure out how serious is an injury, what do I need to do about it.
Yeah. If the injury happens during a show or a class, how can a dancer tell if she can safely finish the show or the class?
Now, this is a tricky one because Nine times out of 10, between the choreographers, the excitement of the show, and adrenaline, just being like, I'm on stage, I'm so excited. I've worked for months for this. I can't wait. I'm in costume. I look gorgeous. I want to be out there. It's hard to really get a good pinpoint on pain, because pain kind of hides behind the adrenaline that's pumping. You're not really going to feel it as much. I would say it's just about the same as the yellow or the red flags. Those are going to be your cardinal symptoms that's going to say, this is a problem, you can work through it, or this is not so much of a problem, you can probably go a little bit easier in the show, get a little bit help backstage. If you have a PT that works with your company, get a little bit of triage, and then you should be able to go through the show. So again, it comes back to those yellow or red flags for me, in terms of if it's something very serious and you're not able to bear weight, you have lots of pain that you haven't experienced before. It unfortunately, there's nothing in that show or that anyone can do to help you, and you're not going to perform your best in any case. So at that point, you probably need to step aside, speak with your teachers and your choreographers about the show. If it's something that's a little bit milder, which is a yellow flag, then we're talking about how can we modify. Maybe we can change your choreography around, so you can do it to the left instead of the right, if the right is your problem, or if you have a trained professional PT backstage that can help you and do some triage, help you get through that show safely.
Yeah. And by triage, you mean just giving you that medical care.
Exactly.
Yes.
Mm-hmm.
What are the risks if a dancer finishes a show or class in a potentially serious versus a minimal to moderate serious injury?
The risks kind of come along with how much damage are you going to do, and I think that this is something that not only dancers but also teachers and choreographers should ask themselves. If you have a student or you have a dancer that's injured and they are getting ready for a performance or for a show or even for class, how much damage do you think is going to be done if this person keeps doing this activity? And that comes back again and feeds into the yellow or the red flags. Pain is usually the big cardinal, flag that your body is saying, hey, you need to stop. With a moderate or a mild injury, there's not a lot of risk for obvious reasons. Usually the body is very immediately responsive when you have an acute injury. If you've rolled over your ankle, you're going to have a lot of swelling, you're going to have a little bit of moderate pain, but it calms down over time. So if it's a mild injury, there's chances are that you can work through it, and the risk of having any long-term damage is going to be lower. However, if you have a serious injury, first of all, chances are is that you're not going to be able to perform. That's just the reality of it. But if you do have a serious injury and for some reason that dancer is able to mask that pain or still able to perform, you're actually risking the longevity of your career. You're risking not being able to dance in the next show, because your body will do just about anything you ask it to do. But most people don't dictate how they do it, and the how is the consequence that it's going to really kind of come back later on in terms of, are you able to really get through your full plie if you've strained a muscle or something like that. And the longevity of your career is really in jeopardy at that point if you do decide to push through an injury to perform at a show.
Yeah, I mean, if it's pushing you to hold back from things and you're having to mindfully ignore that as you're trying to get to the movement, that's a sign.
That's a sign. But you would be surprised how many people ignore that sign. I have a million stories about that.
I've done it myself as a dancer, so I get the mindset.
Absolutely.
I was wondering, in your experience, what are common injuries you have seen happen during shows and classes most often?
In shows and classes, chances are, it depends on timing also. In the beginning of the semester, everyone is usually very fresh and very happy. I'm back from summer or I'm back from vacation, and they're in it. And about week 3 or week 4 of intensive programs, people start falling off, because that's when you start getting into the regular scheme of overuse injuries. Dancers usually experience most of their injuries in the lower extremity, and over 50% of that happens at the foot and ankle. So you're going to get your ankle sprains, your posterior tibia tendonitis, your Achilles tendonitis, FHL, perineal, maybe some plantar fasciitis in there. Just about anything that can happen with the ankle starts popping up. Sometimes in the past, I would say 2 years, I should say, I've started to see a lot more of hip issues, hip feeding into the lower back issues. And that comes from a lot of improper technique and training, and just a lack of core stability to really hold the leg in the positions that we need to hold them functionally. But the majority of things that usually come up are either the overuse injuries that happen over time at the foot and ankle. During shows, you're looking into the more acute traumatic stuff. So the slips, the falls, the strains, getting excited and whacking that leg way too high. You don't have the flexibility and your hamstring goes, that sort of stuff. So.
Yeah. Thank you. I think you pretty much got into the causes as well, which is great to really just understand for a dancer listening exactly not only what are common injuries, but also what they should think about, how they're approaching their skill set in class and on the stage that could be putting them at risk.
100%. Yes. It really, when we're talking about injury prevention, not so much the recognition, but the prevention, it really kind of comes back to addressing the root cause of the problem. And in just about any injury, you can track back with the help of a skilled professional, of course, the cause of an issue. If you've had consistent hip flexor tendonitis, for example, and every time that you get that leg to the front and to the side, you have pain, there's an underlying cause for that. And chances are it's probably in your pelvic floor or your core or your inability for your spine to really hold that leg straight so that hip flexor is working both ways, stability and also in moving that leg into that ground bottom position. So in terms of dancers really trying to figure out, well, what do I do to fix that? It usually kind of comes back down to technique. 9 times out of 10. There are some things that just kind of happen, but in proper technical training, 9 times out of 10 is going to set you up for the injury incidents that a lot of dancers have.
Oh, yeah. All right. We're on to our final question.
Mm-hmm.
Just also a great opportunity to really learn even more of your personal experience and how it has driven your passion into working with dancers. So please tell us your favorite story about treating a dancer.
Man, and this is hard because I have so many, but and I love my dancers. Just my whole experience of getting into physical therapy was my personal experience as a dancer and having someone heal me when I was injured. So they're very close and dear to my heart. The incident that I can think of is actually twofold. I was working at Kennedy Center for Little Dancer, which was a musical, and I had 2 encounters that stayed with me. One was the youngest little girl in the cast. She was way younger than everyone else. And I was working backstage and she came in and we got to talking as we were working together. And she's giving me all these stories about, I'm doing this in New York and I'm going away and I have an audition in Russia. And I'm like, Russia, this girl is not even 12. And she's so cute and so talented. And it was just amazing to be around that energy of an excitement of, I am so excited to be here. I can't believe that I'm in Kennedy Center. And, she's professional, but so excited. And it really brought me back to those moments when I myself performed. And, it was just really enjoyable. And the second one was working with another member of the cast. I didn't realize how huge she was at the time. But she came in and she was one of the lead members of the cast. And turned out, a couple of months later, I see her featured, and I'm like, wait, I know this lady. She's Tyler Peck, and she was so cool and so sweet. And it was honestly the joy that I get out of working with dancers is really just getting them healed and giving them that same experience that I had. So for her to come in and for me to able to work with her and for her to get rave reviews at the Kennedy Center was all that I could ask for. So
I love that.
Yeah, so that's my stories.
This. Thank you so much again for coming on here, Danelle. This has been a pleasure. If anybody listening, you want to learn more about how you could reach Danelle more one-on-one, you can go to her website, which I will be including in the text for this podcast. So thank you to all of the listeners for joining us for another episode of Physiotherapy Performance Perspectives. Please join me on the first Monday of every month for the next episode. To hear more episodes, click on the link in the description below to view the website. Like the podcast on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, please email me at ptperformanceperspectives@gmail.com. Thank you so much. Bye.